This video will get you up to speed with the most important features of the InteliDOX prescription module, including accessing the patient's medications list, tracking over-the-counter meds or those prescribed by other providers, creating new scripts and transmitting them to pharmacies electronically, also known as ePrescribing, checking for drug-to-drug and drug-to-allergy interactions, renewing scripts, and managing electronic refill requests. With the exception of electronic refill requests, which will be covered later in this video, you'll manage all the patient's medication needs by selecting the patient from the appointment screen or the patient list, then clicking the Meds button on the toolbar or on the Patient Notes bar. This brings up the patient's meds list. Medications that the patient is actively taking will be shown in green, dark green for scripts generated by your practice, and light green for external medications, which are those prescribed by other providers or OTC meds. Prescriptions that have run out or lapsed are shown in yellow, and scripts that were marked stopped before they were scheduled to run out are shown in gray. By default, active scripts are shown at the top of the list, but you can click at the top of a column in the list to sort by another order. For example, click at the top of the medication column to sort the list alphabetically by drug names. FYI, if you see a red exclamation point like this next to a medication, that means an exact match for the medication could not be found on the InteliDOX drug list. This can happen with prescriptions created in earlier versions of InteliDOX or with external meds that were manually entered or imported into InteliDOX. InteliDOX won't be able to check medications marked with exclamation points against the patient's allergy list or to warn you if these drugs interact with other medications that the patient takes. If the patient will take any of these drugs again in the future, you should create a new script from scratch for the drug instead of trying to renew the old script with the exclamation point. While we're on the subject of external meds, a term that covers any drug the patient takes that wasn't prescribed by a provider in your practice, let's talk about how you can add external meds to the patient's medication list. There are two ways: using the InteliDOX drug list or using the PBM medication history. PBM, or Pharmacy Benefits Management History, isn't available for all patients, and when it is available, it may be incomplete. But it can be the quickest and easiest way to update the patient's external meds, so let's try that first. In this case, InteliDOX found records for several external meds. If the patient is still taking one or more of these, we can import them into InteliDOX by clicking either the Manual link to fill in details like the start date and SIG manually, or by clicking the Auto link to let InteliDOX automatically import however much detail is available. If the PBM medication history doesn't include a drug that the patient currently takes, you can add it manually. Click the down arrow button to the right of Add External Med, then click Using InteliDOX. Start typing the drug's name, then select the dosage and form of the drug from the list. Set the date on which the patient started taking the drug, fill in as many other details as you can, then click Save. Now let's discuss how to generate new scripts. Start by clicking the New Rx button at the bottom right corner of the Meds screen. At the top of the screen, you'll see the patient's allergies and demographic information. Near the bottom, you'll see a summary of the patient's insurance eligibility information, if that's available. For full details, click the I button, scroll through the window that pops up, then click Less to close the window. On the right, you'll see a list of tabs from which you can select what you want to prescribe. The My Rx tab shows drugs that you've previously saved, possibly with a complete set of patient instructions. Next, there's the Active Rx tab, which lists all items on the InteliDOX drug list that your system administrator has marked active to indicate that your practice uses these drugs. And there's the All Rx list, which shows the complete drug list. Over time, you'll build up a list of the drugs you prescribe most often on the My Rx list. But for now, let's click the Active Rx tab to prescribe from the list of drugs that are considered active by your practice. The list is likely to be very long. You can scroll through it or click on a lettered tab to jump to drugs that start with that letter, but the easiest way to find the drug you want is to just start typing its name. Whatever you type will appear over here in the drug field. If it doesn't, just click once in the drug field, then start typing. As you type, the list on the right will be filtered to show only matching items. If multiple strengths and/or forms of a drug are available, each will appear on its own line. Just double-click the one you want to select. If InteliDOX was able to find insurance eligibility information for this patient, it may now show you formulary information for the medication you selected. If this box is highlighted in green, the drug you selected is on formulary for the patient. If you select a drug that is non-formulary, this big red box will pop up showing the drug, its non-formulary status, a link that you can click to keep the selected drug if you want, and in most cases a list of alternative drugs that are on formulary. If you really do want to prescribe a non-formulary drug, click this Keep Current Drug link, and the drug will be added to the script. But keep in mind that the generic form of the drug may be included on the list of alternatives, or a different form or dose of the drug may be on formulary. And in most cases, at least one alternative on formulary drug will be displayed. If any drug on this list is acceptable, click the strength and form that you want, and that'll be entered on the script for you. Next, you'll need to fill in the day's supply, refills, and dispense fields, and provide patient instructions in the SIG field. You can enter all this information manually, or you can click the Quick SIG Aid button to get help with that. The default instructions are take 1 unit once a day by mouth, but you can change the number of units, the frequency, or the delivery route. And you can add special instructions such as PRN for pain or with food. If you use the Quick SIG Aid, it will automatically calculate the number of units to dispense for a 30-day supply. If you increase the day's supply value, the dispense value will automatically be recalculated for you. The refills value defaults to 0 for no refills, but you can change that with a click, and you can check the Allow Generic box if desired. The Note to Pharmacist field is just what it sounds like, a place where you can enter instructions for the pharmacist that won't be included in the patient instructions. For example, this is where you can enter details like label in Spanish or no childproof caps. If this is a medication you routinely prescribe, you can add it to your MyRx list by clicking the Add to MyRx button. All the details that you entered will be saved on the MyRx tab, and next time you can just double-click that entry to fill out a prescription in no time. Once you've entered all the details for a medication, either manually or by selecting it from the MyRx list, click the Accept button. A summary of the information for this medication will appear in the grid right below the patient's demographic information. You can prescribe more than one medication at a time if needed. Just select the next medication from your MyRx list, the ActiveRx list, or the AllRx list, fill in or change the details as needed, and click Accept. Please keep in mind that electronic prescribing of controlled substances is not yet available. You can include multiple medications on one script, but if you want to send the prescription electronically and the patient needs any controlled drugs, be sure to do those on their own script, separate from the meds that you'll send electronically. To change or remove a drug from this script, click the Prev for Previous or Accept button until that drug is highlighted on the grid, then make your changes and click Accept again, or click the Delete button to remove the drug from the script. When the script is ready to send, InteliDOX can help you phone the prescription into the pharmacy, fax it, send it to the patient's print queue or print it immediately, transmit the script electronically, or just save the script without printing or sending it. For example, if you wrote a prescription by hand but want to track it in InteliDOX. If the script includes any controlled medications, you'll probably print it. Check with your BusyNet trainer or the tech support department if you need any help with configuring your printers or your prescription form layout. If the script doesn't include controlled meds, we strongly recommend that you use the Transmit option to send the script to the pharmacy electronically. This is known as ePrescribing, and it's the fastest and safest option, and it helps you satisfy meaningful use requirements to qualify for Medicare or Medicaid incentive payments. To ePrescribe, click the Transmit button. InteliDOX will check the drugs on the script against the patient's recorded allergies and existing medications, but remember, not those that are marked with red exclamation points on the patient's meds list. If any potential problems are found, they'll be listed, along with links to additional details. If you want to change the script based on these warnings, just click the Change this prescription button to return to the prescription entry screen. To continue with the script despite the warning, click the red Prescribe Anyway button. Next, you'll see a list of pharmacies that can receive prescriptions electronically. If a prescription has previously been sent for this patient, the last pharmacy used will automatically be highlighted for you. Otherwise, all pharmacies located in the patient's home city and state will be listed, as well as all mail-order pharmacies. If you only want to see retail pharmacies, just uncheck the SureScripts mail order box. You can use these buttons at the bottom of the pharmacy list to search for a pharmacy by name, address, city, state, zip code, and/or phone number. Click the Reset button at the left to clear out any search settings you've entered and to view the complete pharmacy list. When you find the correct pharmacy, click it. To actually transmit the script to the selected pharmacy, click the ePrescribe button down here at the right. InteliDOX will display a summary of the prescription, and if you need to include information like the patient's primary and secondary diagnoses, prior authorization information, or your supervisor's name, this is where you do that. If you see that changes to the script are needed, or if you want to cancel sending the script, there are buttons for that here. But if everything is okay, click the green button to continue. You'll get one more chance to review the script, and you can still back out at this point, but if everything is okay, click the green Send Now button to transmit the script to the pharmacy. After a few seconds, the patient's medication list will reappear with the new medication on it. As you saw earlier, InteliDOX automatically checks for drug-to-drug and drug-to-allergy interactions as you create new scripts, but only the drugs on the new script will be checked then. If you want to check everything on the patient's active meds list for interactions, click this Check for Interactions button. Remember, drugs that are marked with red exclamation points will not be included in this check. Click the X at the bottom left corner of the window to close it. Prescriptions that were generated by your practice and that have run out or are close to running out can be renewed using the Renew Selected button. Click on the script you want to renew, click Renew Selected to open that script, make any needed changes, then transmit it as usual. ePrescribing will change the way that you handle refill requests. Once pharmacies start receiving new electronic scripts from your practice, they'll quit faxing refill requests to you and start sending refill requests electronically. At least once a day, check the Alert window down here at the bottom right corner of the InteliDOX screen to see if you have any refill requests. Click the Refill Request link to see the actual requests. Each request will include the date and time the request was sent from the pharmacy, and the patient's name, gender, date of birth, and home address. If that information matches a patient in InteliDOX, the request will automatically be linked to that patient's account, and there will be a link that lets you view the patient's current meds list. The refill request will also include the name and contact info for the pharmacy that sent the request, the prescriber's name and contact information, and a summary of what was previously prescribed and dispensed. This first request is one that cannot be handled electronically, since it's for a controlled medication. If the patient actually needs a refill of this controlled drug, you can click the View Patient Meds link to open this patient's meds screen, create a new script for the drug, and handle it appropriately, for example by printing it. Then, to remove this request from the list, you can click the Deny button, check the Request Already Responded to by Other Means box, and click the Send Denial Now button. The next refill request also cannot be handled electronically just yet because InteliDOX couldn't tell which patient it belongs to. There's no account number shown here. You can fix that by clicking the Change link and then selecting the correct patient. Now you can click the View Patient Meds link to review the patient's current meds, close that screen and return to the refills list, and click the Approve button to let the pharmacy know that they can issue the refill. Here's another request. You can review the patient's current meds list, and you could approve the refill request as it's written just by clicking the Approve button. Let's say that you want to make changes to the medication, its strength, or the dosage instructions. To do that, click the Deny New Rx to Follow button, then click the Send Denial Now button. InteliDOX will send the denial message to the pharmacy, then open the prescription entry screen so you can immediately create and transmit the new script. After you send the new script, the refill request will disappear from the list. If you have any questions about the InteliDOX prescription module or about managing electronic refill requests, please send us email at support@busynet.com or give us a call at 918-858-4440, voicemail option number 2.